class, we're going to continue with Chapter 1, Holes, Essentials of Human Anatomy and Physiology. Part 1, we talked about a little bit of introduction and then homeostasis. So now we'll pick up the organization of the human body. The body can be divided into an axial portion, so that's the head, the neck, and the trunk, and the appendicular portion, which is the upper limb and the lower limb. Now, the axial skeleton has 80 bones, and the appendicular has 126. So total bones in the body is 206 bones. The axial portion contains several cavities that house body organs. So the cranial cavity, the brain, the vertebral canal has a spinal cord, the thoracic cavity has heart, lungs, mediastinum, and then the abdominal cavity, as you can see, is the stomach, the liver, the spleen, gallbladder, kidneys, most of the intestines. And then the pelvic cavity, a little bit of the large intestine, urinary bladder, and your internal reproductive organs. And then you have a diaphragm that separates the thoracic from the abdominal pelvic cavities here. So if you look at this image here, there's the cranial cavity, there's the vertebral canal, there's that diaphragm that separates the thoracic cavity from the abdominal cavity, and then there's the pelvic cavity here. So you can look at different views. There are small cavities within the head. So you have the oral cavity, which is the mouth area, contains the tongue and the teeth. The nasal cavity, which is inside the nose, divided into left and right portions by the nasal septum. The orbital cavities contains the eyes, along with their nerves and skeletal muscles. And the middle ear contains the middle ear bones, which are the smallest bones in the body. So the stapes, the incus, malleus, incus, and stapes is how I remember it. If you look at these small cavities, you have the cranial cavity, but then you have your sinuses. People say, oh, my sinuses are clogged up, right? So you can look at these. These are the frontal sinuses. You have sphenoidal sinuses. You have a nasal cavity. Here's your oral cavity. And we'll go over these when we do the respiratory system and how some of these can get infected. All right. Now, if you look at thoracic and abdominal membranes, you have double-layered membranes. The parietal portion lines the wall of the cavity, and the visceral portion covers the internal organs. So the viscera, that's the internal organ, and the parietal is along the wall cavity. You can get fluid along that lines, and you can get pericarditis, which are the pericardial membranes. You've probably heard of that from COVID. But pericardial membranes surround the heart. So pericarditis, itis meaning inflammation. Pericarditis is inflammation of that lining. Pleural membranes line the thoracic cavity. The parietal pleura lines the inner wall of the thoracic cavity, while the visceral pleura covers the lungs. A thin layer of serous fluid separates the two layers. Potential space between layers is pleural cavity. Now that fluid sometimes can get dried out due to bacterial infection or some kind of injury, and sometimes we get something called pleuritis, and people get a lot of pain when they try to take a deep breath in because of pleuritis when that fluid gets dried out or some kind of injury. The treatment is anti-inflammatories and some cortisone. Going back to pericardial membranes around the heart, the parietal pericardium makes up the outer layer. The visceral pericardium covers the heart. Again, serous fluid separates the two layers, and potential space between the layers is called the pericardial cavity. So when that fluid kind of dries out, it's like rubbing sandpaper together, and it can be very, very painful. And the peritoneal line the abdominal cavity, and the peritoneum lines the wall, while the visceral peritoneum organs potential space between the layers of the peritoneum. So if you look at the transverse section, which is this way, okay, you can see this. Here's the left lung, here's the right lung. When we go into the respiratory system, we'll talk about the different lobes in the right lung versus the left. The right has 3 lobes, the left has 2 lobes. Here's the spinal cord, here's the vertebrae, here's your aorta, and here is your azygous vein. Remember, arteries take blood away from the heart, and veins will return deoxygenated blood back to the heart. Here's your esophagus. Here's your heart, left ventricle, right atrium. Again, this is just a view. You don't have to know the cardiovascular system and the respiratory system right now. I'm just giving you an overview. But the main purpose of this image is to show this cavity, this visceral pericardium, okay, the pericardial cavity, okay, the parietal pericardium, the fibrous pericardium. So these are these layers that protect the heart, and these are these layers, the visceral pleura, the pleural cavity, and the parietal pleura, that protect the lungs. Now, in between these layers, like I was mentioning before, you have fluid that will help kind of lubricate and cushion the heart and the lungs. And bacteria and viruses can get in here, and then sometimes they can get inflamed, they can get dried out, so that can be a problem and very painful for a lot of patients. Here's the transverse section through your abdomen, so we're going more inferior now. A lot of stuff going on, right? So if you look at here, here's your kidneys. Now the right kidney is lower than the left because of the liver. So your right kidney is a little bit lower. Here is your liver. Okay. Here is your stomach, large intestine, your spleen. Okay. Here's your liver and gallbladder. Again, this is more of the GI tract. We don't really cover the GI tract so much in this class, but it kind of gives you an idea of where everything lies. Everything's close together, so you can see how an injury to one area can affect another because of the close proximity of all the internal organs. The body consists of several organ systems. Each system contains a group of organs that work together to accomplish a specific function. And of course, each system contributes back to what we were talking about, the homeostasis. A system that provides the body covering is the integumentary. That's your skin, right? It includes the skin, hair, nails, sweat, sebaceous glands. They protect underlying tissues, helps regulate body temperature, senses change via a variety of sensory organs, and synthesizes certain products. So your skin is like your first line of defense. If bacteria and viruses can get through the first line of defense, then we have a problem. So you want to take care of your skin, moisturize, don't keep them dry, take care of your hair, nails, all that good stuff. Hygiene is very important. Body systems that provide support and movement. We've got the skeletal system. We're going to spend a lot of time in this class on the skeletal system, bones, ligaments, and cartilages. Now, real quick, the difference between tendons and ligaments. So ligaments connect bone to bone, and tendons will connect muscle to bone. Fascia connects muscle to muscle, so that way you know the difference between a tendon, ligament, and fascia. Supports and protects soft tissues, includes framework, stores inorganic salts, and houses tissues that produce blood cells. So the skeletal system is very important. The muscular system, which we'll spend another majority of the class in, consists of muscles. There's a lot of muscles. I would say probably about 600 that you should probably be familiar with. Now, don't get too scared. You don't need to know all 600. Probably we'll spend most of the time on about 75 to 80. Still a lot, but most of these more of the superficial muscles and not really the finite muscles that are in your hand and your feet. But if you were to go technical, including smooth muscle, there could be over 1 million muscles. And the reason is every hair that you have is attached to a recti pili muscle. And that, when that contracts, it gives you goosebumps. So if you were to count all those, and if you counted all the hair follicles on you, then you could easily know that there's about 1 million muscles. But don't freak out. We're only going to learn about 75, 80 of these. Muscles also provide body movement and posture, and is a major source of body heat. Remember what I mentioned, shivering will produce heat. Nervous system, the brain, spinal cord, nerves, and sense organs. Cells communicate with each other and with muscles and glands via neurotransmitters. The neurotransmitter that you probably know the most is dopamine. Every time you're texting somebody or somebody texts you back, you get a dopamine rush. So that's dopamine. very important neurotransmitter. We're addicted to certain things because of dopamine. We feel that rush. But there's other neurotransmitters out there: norepinephrine, epinephrine, acetylcholine. I can just go on and on, but you're not going to have to know all those neurotransmitters. I'm just giving you some examples. Nerve cells function in either sensory, reception, integration of incoming information, or stimulation of muscles and glands. So there's a lot of function of the nerve cells. One interesting fact is that nerve cells do not undergo mitosis. So neurons do not undergo mitosis. Mitosis is division of the cells. So if they don't, excuse me, then they would not get cancer, right? So neurons have a very difficult time replicating, so therefore there's no cancer. Now, there are other cells in the brain called glial cells that do undergo mitosis, and they can get cancer. So just FYI. The endocrine system, now the difference between the nervous system and the endocrine system is the endocrine system uses chemical message called hormones. You've heard of hormones: testosterone, estrogen. There's a plethora of hormones. The hypothalamus, pituitary gland, thyroid gland, parathyroid, pineal gland, thymus glands, pancreas, ovaries, testes, they secrete hormones. The difference between the nervous system and the endocrine system is the nervous system is fast reaction, boom, 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 boom. The endocrine system will say, okay, well, I need to release this hormone, and by the time it reaches the target organ, it might take a while. But once it reaches that target organ, it will have a longer lasting effect. So hormones are slow to respond to neurotransmitter, but they last longer. Cardiovascular system, we're going to spend a lot of time on the cardiovascular system. Consists of the heart, blood vessels, and the blood. Distribute oxygen, carbon monoxide, nutrients, and hormones throughout the body while removing waste from the cells. The lymphatic system is basically picks up this lymph, which is left over in the interstitial fluid between the arteries and veins. So the lymphatic system is very important because it drains excess tissue fluid and returns it to the blood. Now, let's say you sprain your ankle. You get swelling, correct? And that's the extra fluid, the excess fluid that the body cannot pick up, the lymphatic system. Now, throughout your career, I say career, or your athletic career, you've been told to ice for swelling. Unfortunately, if you know the body and lymphatic system, the lymphatic system is an active transport, meaning it needs muscular contractions to flush that fluid out of your ankle. So just by icing it alone, you're not going to get rid of the swelling. You need to actually pump the ankle and flush it out of there. So that's the best way to get rid of swelling. So when people say you should ice it for swelling, it's not accurate. Muscular contractions are what actually get rid of swelling. So movement in general will get rid of swelling. Lymphocytes are a type of white blood cells used for immunity. They defend the body against infection. So you have T lymphocytes, B lymphocytes. Again, we don't go too much in depth in this class, but having an idea of what these do is important. I'll go over it a little bit later. The digestive system, of course, consists of the mouth, tongue, teeth, pharynx, esophagus, stomach, intestines, accessory organs. Breaks down and absorbs nutrients and excretes waste. We don't spend time on the digestive system in this class. We focus most on musculoskeletal, respiratory, and cardiovascular. So respiratory moves air into and out of the lungs and exchanges oxygen and carbon dioxide between the blood and the air. Consists of the lungs and air passageways, nasal cavity, pharynx, larynx, trachea, bronchi. And we spend quite a bit of time on this a little bit later. We won't talk about the urinary system too much in this class, but it's the kidneys, the ureters, bladder, and urethra. Removes waste from blood and helps maintain water balance. Produces, stores, eliminates urine. Again, checking if you're hydrated. Look down when you go pee, and if it's light lemonade, then you're hydrated. If it is clear, you're drinking too much water, and if it's dark yellow, then you need to drink some water. Okay? And remember, if you go to bed dehydrated, you're going to wake up even more dehydrated. So always check your urine before you go to bed. And if it's on the darker yellow side, drink a glass or two of water before you go to bed. Now, the reproductive system, again in this class we don't spend too much time on the male or the female reproductive system, but the male consists of the testes, scrotum, epididymis, ductus, torrential, seminal vesicles, prostate gland, vulvourethral glands, penis and urethra. Produces and maintains sperm and connect them to the female reproductive tract. The female reproductive tract consists of ovaries, uterine tubes, uterus, vagina, clitoris, and vulva. Produces female sex cells, receives male sex cells for fertilization, and houses the developing offspring and functions in childhood. Again, we have 46 chromosomes in our body. We get 23 from dad and 23 from mom. So when 23 and 23 come together, you make 46. A lot of people like the number 23. Michael Jordan, 23 in sports, 23 is. But if you look at the history of the number 23, it actually goes back to the Bible, and it actually goes into creation. So it's actually a very interesting number. So if you ever were 23 when you played sports, you want to look into the meaning of it. It's actually kind of interesting. Now, the organs for homeostasis. Again, all these work together to keep your body in balance and homeostasis. So the skin, integumentary system, skeletal, muscular, nervous, endocrine, cardiovascular, lymphatic, digestive, respiratory, urinary, reproductive. In this class, we'll focus on the skeletal, the muscular, a little bit of nervous, cardiovascular, and respiratory system, to how it affects musculoskeletal injuries, and more based on sports and kinesiology, biology. Okay. Now, one thing that you do want to know is what's the anatomical position. So whenever we refer to somebody, we're always thinking the anatomical position. So that definition, you definitely want to know this, is the body is erect, you face forward, the upper limbs are at the side, so palms are facing forward. Terminology assumes that body is anatomical position. So if I'm describing somebody, I always assume that they're in the anatomical position. Not that they're on their side, not that they're on their stomach. I always assume the anatomical position so that we have a common reference point for everybody. Now there's a fundamental position. The fundamental position is the same except for the hands are to the side. Okay, so that's the difference between the anatomical position and the fundamental position is the palms. Now you do want to know, if I'm describing somebody, some of this terminology, this anatomical terminology. So superior means above, inferior means below, anterior means front, posterior means toward the back, medial is toward the midline, and lateral is away. So let me give you an example. My head is superior to my chest, right? So my head is superior to the chest. My shoulder is lateral away from to my sternum, right? Here's my sternum. So my shoulder is lateral to that. Okay? Now anterior, my ribs are anterior to my heart. Correct? So knowing this terminology is very important because we don't say above, below, in front of, and back of, because it doesn't, that terminology can be confusing. So we use anatomical terminology such as superior, inferior, anterior, posterior, medial, and lateral. And get in the habit of using that terminology because you might see something like this on the quiz or the test. Bilateral means both sides. Ipsilateral means it's on the same side. So if I hurt my right shoulder and my right knee, then we have ipsilateral injuries. But if I hurt my right shoulder and my left knee, then I have contralateral injuries. Proximal means I'm closer to the body, so my shoulder is proximal, right? Distal means furthest away, so my hand is distal to the elbow, it's further away. Okay? My knee is distal to the hip, it's further away. Superficial means, so my skin is superficial to the ribs, but my heart is deep to my skin, so more internal. So get in the habit of using these terminologies because I think it's very, very beneficial. and plus you'll be tested on it. Here's the anatomical position again. Palms facing forward, anterior, posterior. Here's your right, left side. Medial is toward the midline. Lateral is away. Proximal, again, is closer to the trunk. So my hip is proximal to the knee. Okay? My shoulder is proximal to the elbow. But my elbow is distal to the shoulder, right? So the elbow is further away. So learning proximal versus distal. Distal is far away. Proximal is closer. Now, study of body organization and relative locations of body parts requires cutting the body along specific planes or sections. So sagittal cut, or a sagittal section, longitudinal section that divides the body into right and left. So I'd be cut between right and left. That's called a sagittal section. If the section passes along the midline and divides, that's called the mid-sagittal. So right along the middle is the mid-sagittal. But if it's away from that, this would be a parasagittal cut. Okay, so mid-sagittal, parasagittal. A transverse cut would cut between superior and inferior. So cut this way. And then a frontal cut or a coronal cut would divide my body into anterior and posterior portions. So let's see. If you look at this diagram, if you look at this cut right here is a transverse cut. So in an MRI, a transverse plane, you would see this. If you were to do a frontal or coronal cut like this, you would see the knee. So an MRI done in the frontal plane would be beneficial to see if we have a torn ACL. And then a mid-sagittal cut right down the middle, you can see half of the brain or half of one side. Now one thing, if you were to do a mid-sagittal, you would want to know what side, the right or the left, because remember, certain organs are only on some sides. So the liver is only on the right side. So if you did a parasagittal and you were trying to look at the liver, you would need to do a right image, right, versus a left. The stomach's on the left, so we would need to do a parasagittal plane on the left. So you want to know the basic structures and the organ systems, where they're located, before you order the right imaging. Otherwise, you're going to miss what you're trying to look for. Okay. Now, let me give you an example. What if I wanted to see both lungs, a heart, all my intestines, the liver, and the reproductive organs? What do you think, which would be the best imaging? So you got to think about it. If I want to see all the organs, well, if I do the mid-sagittal, I'm going to cut out half. If I do the transverse, it's only where I do the transverse. So the only way that I'd be able to see everything is if I did a coronal cut of the abdomen or thoracic cavity region right here. Now, cylindrical organs such as blood vessels or long bones have their own set of sectional terms, like a cross section, oblique section, and a longitudinal section. So that's for blood vessels and long bones. So if you look at this, okay, so if you look at A, B, and C, okay, longitudinal, oblique, cross-sectional. Now, you also want to know where the body regions of the abdominal area. So the epigastric region is right here, okay, if you can see, right here, epigastric region. The right and left hypochondriac is to the sides of the epigastric region. The umbilical is the middle part where your belly button is. Right and left lumbar to the sides of the umbilical. Pubic, you got the hypogastric, and then you've got the inguinal, the right and left inguinal to the sides of the pubic region. Your body can be divided into quadrants, upper and lower quadrants on the right and left as well. So from a quiz standpoint, you would want to know which organs are in which quadrant and which region here. So if you were to look at this, you can see that the liver, which is right here, is found in the epigastric region and the right hypochondriac region. You can see that the gallbladder is found in the epigastric region. Here's your stomach, that's found in the left hypochondriac and epigastric region. The umbilical region mostly has your small intestine. The left lateral region or left lumbar region has your small and large intestine. Your right lateral or lumbar region has the large intestine. And then if you look down in the pubic region, that's where your small intestine and your urinary bladder is. Your appendix is actually in the right inguinal region. And then in the left inguinal region, you have your sigmoid colon. So knowing which organ, so a good quiz question could be which organ is found in which region. So that would be something that you want to spend some time on. Now there are organs that overlap. As you can see, the liver is found in both of these. The stomach is found in both of these. The small intestine is found in several regions. So make sure you go over this information. The quadrant, there's only 4 versus 9 regions. So the right upper quadrant, that's your liver, gallbladder, small and large intestine. Your left upper quadrant, mostly the stomach. Your spleen's back here. Your pancreas is behind the stomach. Your right lower quadrant, mostly your small and large intestines, your appendix, and your left lower quadrant, small and large intestine, sigmoid colon. Your bladder is split between the two. Now, you do have this terminology that you want to be familiar with. So instead of saying head, we might use cephalic. Instead of saying forehead, we might say frontal. Instead of saying eye, we might say orbital region. So these are the anatomical names for it. Instead of saying low back, we use lumbar. Instead of elbow, we say cubital. Inguinal is also your groin area. Femoral is your thigh. Now, one thing that a lot of people get confused on is calling this portion the leg. This is not your leg. It's really your femur and your thigh. Your leg is actually from the knee down. So people say, oh, I hurt my leg. Well, from a true sense, your leg is below the knee. Okay? So it's like if they say, oh, I hurt my arm. Your arm is actually from your shoulder to your elbow. This right here is your forearm, okay, the antebrachial. So going over this and knowing all the accurate anatomical names is very important. So then you'll be able to read a medical chart. Okay. All right. Well, that concludes chapter 1. A lot of information. Sorry if I went a little fast, but you can go back and look at some of the stuff, and hopefully that helps. All right.